Being tongue or lip tied is a condition that many babies are born with and could lead to feeding and speech problems, but there is an easy treatment. Joining me now is Dr. Bradley Briggs from Briggs Family Dentistry. It's good to see you. Thank you for being here. Very interesting topic. What is tongue or lip tied?
Tongue or lip tied is when the developmental tissues that create the tongue and the lips fail to unattach from the floor of the mouth and the jaw or the gums on the top.
Okay, so we're looking at a picture here. And what is this one?
That's a lip tie, and so that's a baby where the frenum is still attached to the gums in the front, and that's a fairly common occurrence. That's a tongue tie that we're looking at right there. It's an anterior tongue tie, so that doesn't allow the tongue to raise up in the mouth.
And how does this affect the baby?
It affects the baby in many different ways. The biggest, when they're newborn babies, is that they are unable to breastfeed normally. So babies cannot get the attachment, they don't feed as well, they end up with colic or gas. Developmental newborn babies will not gain weight because they're not getting the nutrition that they need. So it's a condition that really affects newborn babies.
Very interesting. So in this situation, that picture, they're not able to really breastfeed well. And is it generally treated by a pediatrician?
A pediatrician will diagnose it. They do treat that in the hospital. Many times that involves doing sedation. They use a scalpel or cut the tissues and will often require stitches. So it's a fairly uncomfortable thing for a baby to deal with when treated traditionally.
So tell us about how you do it now, because you use a laser, right?
We have used dental lasers in our practice ever since I've been a dentist, so almost 10 years, and I practice with my father, so he's been using them a little longer than that. The benefits of treating this with a laser is that we don't have to do any sedation. We treat it, the laser cauterizes as it goes, there's little to no bleeding. No post-operative pain. So when treating them, a baby can go right to the waiting room and start nursing.
Oh, look
and
at you!
Successfully.
Well, so right after, is this a baby that you just
We just finished. I just took her out of the chair, and she's yawning, not crying.
No.
And then Mom took her to the waiting room, and she immediately was breastfeeding and able to do it successfully.
Wow.
Not painful for the mother because they're actually breastfeeding in the correct way.
Huh. And the mother, so she immediately noticed a difference with the baby?
Immediately, yeah.
That's amazing. So you can treat babies with this?
It's actually best to treat newborn babies before they start developing problems. Now, we can treat anyone up to teenagers or adults who are still tongue-tied.
Wow, you know, so people, I guess I'm surprised that I didn't think people would still continue going on with having this issue.
Teenage girls who were unable to lift their tongue, and we cut that back and got them back to normal.
Because you said it could create speech problems too, right?
Well, the developmental problems that come along with attached tongue and lips, it will pull on tissue, bone, and can create problems. So a lip tie can create orthodontic problems later where there's spaces between the upper front teeth or lower front teeth. And the treatment with orthodontics can be very time-consuming, very costly, and it's something you could avoid with a simple dental surgery when their baby's young.
Wow, very interesting information. Thank you, Dr. Briggs, for sharing that with us. So glad that you can do that and help these little guys out. That's wonderful.
It's rewarding.
I bet, yeah. And if you would like more information, or if you want to contact Dr. Briggs, of course, you can visit him online at briggsfamilydentistry.com, or you can always go to the phone number that you see right there on your screen. Up next, Dr.